Thank you, Rishi, and thanks to all of you for being in a course on microbial keratitis. So my job is to talk about zapping the bug, and I really like what Rishi gave me this thing about zapping the bug. So I'm going to talk to you about a modality which seems to be promising, but we need to be selective about when we use these kind of things. The treatment of microbial keratitis, we know, has been medical chemotherapy. Nothing works, we do a corneal transplant. But with the use of multiple antibiotics all over the years, not only just in ophthalmology, but also in parallel sciences, as well as in veterinary sciences, there is a significant rise in microbial resistance. So what Mukesh was talking about, multiple drugs are being resistant to the regular antibiotics which we are using, and this trend is increasing. These bugs are much more smart than what we think. I mean, we come out with new antibiotic and they probably find out a way to get resistant to that. So is there any way out? Is there any alternative treatment? Well, there's something called PAC-CXL. This terminology was coined in 2013 where they decided to call this as called photoactivated chromophore for infectious keratitis, or PAC-CXL. Basically, this is nothing but the same collagen cross-linking treatment which is done for microbial keratitis. And what is the logic of using this riboflavin-induced collagen cross-linking? Well, riboflavin, almost since last 15 years, has been used to sterilize plasma product, blood products, and PAC cells and all those things. It has shown significant antibacterial activity in these cases. Also, when induced with ultraviolet irradiation, we know that it can lead to significant apoptosis of the cells. So there are a lot of laboratory studies which proved, ex vivo studies in lab, which proved that, well, it can work. It can actually kill a lot of bacteria. It can actually kill fungi also. And it can actually treat some of these multi-drug resistant organisms also. Now, also interestingly, Theo Seiler's group, who were the pioneer in collagen cross-linking, reported one interesting thing, that once we cross-link the cornea becomes a little resistant for the digestion by these toxins of microbes or whatever they secrete to digest the cornea. Hence, chances of perforation may be less, which is very interesting. However, there were contradictory studies also which said that, well, all is not good. It can actually work in some cases, but fungal keratitis, acanthamoeba keratitis, in these kind of cases, it may not work. Even the lab studies from LVP proved that cases like multi-drug resistant were not always amenable to this treatment. Similar to that, acanthamoeba and fungal were also not the best cases. So what is the rationale behind using these things? Well, one, we are making the cornea more resistant for the perforation or digestion. And second, we are inducing the rapid apoptosis of these bacteria. But when we use certain modality like this thing, which is a blanket modality, we have to remember that we can't just kill bacteria. Along with that, some of your own cells, which are like keratocytes, will also disappear from there. Now, so lab part was fine, that it may work and we can try it out. The clinical part, well, there were articles which came out and said that, especially the group of Farhad Hafizi, who's worked a lot in this field, showed that it does work and it does prevent the chances of perforation. Also from RP Center, Dr. Panda published that not only it heals these microbial keratitis, but it reduces the chance of superficial vascularization, which is a very important point. If we can reduce the vascularization, maybe our future treatment like a corneal transplant may have better survival rate. So where do we use these things? Well, definitely this is not the first line of treatment. We have to reserve them where we cannot treat them with medical therapy. So give them enough time for the medical therapy to treat. And please remember, when we are talking about medical therapy, we assume we are talking about definite treatment. Hence, patient need to undergo microbiological assessment and proper treatment which is required for the patient should be introduced. Deeper lesions like what Dr. Ashish showed earlier, which sometimes are difficult to not only diagnose, to treat also, this can be a good modality to treat. Also, as Dr. Panda showed, that we probably can treat these corneas to reduce the vascularization, hence we can have a better outcome of corneal transplant. The procedure is same as our normal collagen cross-linking, but we do not intend to use an accelerated treatment here. We would rather be happy with the Dresden protocol here, a little prolonged protocol. The studies, our group also did study, and I would like to thank Dr. Harsha Nagaraj for sharing these things. That we found out that out of 11 patients who had bacterial keratitis, 8 resolved, and these are, mind you, very severe bacterial keratitis and severe fungal keratitis, which were not responding to routine treatment earlier. Fungal keratitis, we had 50-50 results, and acanthamoeba keratitis, well, it recurred again. But most important thing of all those things were, post-operatively, most of them were asymptomatic. Their pain and everything had come down. Maybe this was destroying those nerve endings, but whatever it may be, it was actually making the patient more comfortable. Also, interestingly, most of them had increase in hypopyon immediate post-operatively. Well, this can be explained by the principle of Jarisch-Hexheimer reaction, where a massive death of multiple microbes occurs together. It leads to endotoxin secretion, and which can actually show as sterile hypopyon. So hypopyon increase does not mean worsening in these cases. So one such case with gram-positive cocci, as you can see, an extensive infection resolved successfully within 8 weeks' time. Mind you, all these treatment had parallel to them the antimicrobials going on. The fungal keratitis, quite extensive fungal keratitis, healed by 7 weeks. As I was showing you earlier, the acanthamoeba keratitis, it healed but had a recurrence immediate post-op. Not everything was rosy about this thing. There were cases which perforated, and there were cases which actually required therapeutic corneal transplant. So when we talk about microbial keratitis and collagen cross-linking, now we have meta-analysis by George Alio and his group, and showed multiple studies which are now been analyzed, and they proved that it does work in most of the organisms like bacteria. Fungal, everybody has their own opinion about that, but I personally feel fungal, not always these things work. Better to perform a corneal transplant early, whether lamellar or deep penetrating. Also interestingly, there was one article where they did something called window absorption, where you do not debride the epithelium. You let the corneal epithelial defect of your corneal ulcer be there, and through that you percolate the riboflavin inside, and they showed good outcome along with this thing. Also, if you look at the literature search, the largest study was by Price and group, and they proved that if you do a proper case selection, actually your outcome can be quite good. The newer device which would be available on slit lamp will definitely help these patients to perform the treatment in the outpatient, because we are not worried about the contamination there. If we are taking care of the regular thing, as we are probably utilizing this window technique and without increasing any epithelial defect. Also, there can be potential use of transepithelial soaking of the riboflavin, which can be helpful. Also, the transepi soaking, which exposed the back or benzalkonium chloride to these organisms. There were studies from Baskin Palmer which proved that these back itself kills most of these bugs. So which may be useful, but it has its own controversies also. There are few studies which claim that there can be potential mutation into the bacteria, and you can have resistance after the treatment. However, we did our study on this thing, and we didn't find any resistance which was induced by collagen cross-linking treatment. But important thing to remember here would be, whenever we talk about any microbe, whether gram-positive, negative, whatever, the way they behave, it depends upon 3 things. 1, it depends upon the microbe itself. Second, it depends upon the microenvironment or milieu. And third, it depends upon the immunity of the patient. Now here in these cases, when we talk about doing the treatment, we are actually modifying 2 of them by changing the microenvironment and trying to change the organism. Hence, it may induce some change which may be not so conducive to us. but we definitely need long-term study to find out what exactly lies ahead for us. So to give the take-home message, PAC-CXL can be helpful in treatment of especially the organisms which are not responding to your conventional treatment. There are various lab studies which prove that it works in at least bacterial keratitis. Fungal part is controversial. However, whenever we are treating these things, we have to remember that long-term trials would give us a better answer. So it's better to report these cases whenever we are doing the treatment. And especially the deeper lesions which are directly not amenable to treatment can definitely be of help. I would like to thank Harsha again for the research work which he had done on the subject, and thank you very much.